Hello, thanks for being with us today. I'm Jonathan Colopy from Your Why. Welcome to Be Well. We're fortunate to have these conversations to help foster a mindful lifestyle of well-being. Today is an important topic about fentanyl. I think most of us have been aware all the attention being brought to the fentanyl crisis in our communities. And so I'm fortunate to have our guest today who has expertise in this particular space. Brandon Like, thank you for being with us today, Brandon.
Well, thank you so much for having me, Jonathan.
Brandon is a licensed marriage family therapist working in the space of adolescent substance abuse. He's with the dual intensive outpatient program at Sharp Mesa Vista Hospital. It's under the auspices of the Changings program. Brandon, what is the Changings program? I'm not as familiar with that.
Well, it's the Changes program. It's just our adolescent dual diagnosis program. So it's an intensive outpatient program, which basically means it's an after school program for teens struggling with mental health and substance use concurrently. So it's about 9 hours a week. It's fairly intensive, but most of our teenagers are here for about 1 to 2 months at a time, meeting with us after school. And it's just a really good resource to have for parents in the community. When I started doing this work, it was the only program like this in the county that at least I was aware of. And now there are several others, which is really important because we're often, have a waiting list, and there's a lot of need for this particular type of program at this point in time.
Well, thank you for doing the work that you're doing. It's very important work, especially with our adolescents of today. That's such a challenging time of life. So I really appreciate the resource that you're offering. Tell me why, where, and how did fentanyl come about? It seems like it has really escalated in the last few years. So, what is fentanyl, and how did it get into our society the way it is today?
Well, fentanyl has been around, in the medical community for many years, many decades. It's a synthetic opiate, which means it's made in a lab, and it's approved by the FDA to treat severe pain, usually related to surgery or complicated health conditions. But over the past decade, it's been made and distributed illicitly and mixed with a lot of other drugs to kind of increase their potency and cut down on the manufacturing costs of people making illegal drugs. So it's been mixed with heroin, cocaine, methamphetamine, Xanax, a lot of fake prescription painkillers, and even at times marijuana. So it's in the past 10 years that really this has become a more prominent issue. And it's really contributed to dramatically surging rates of overdoses and deaths among both adults and teenagers. For instance, in 2021, 1 in 5 deaths in California, and that's not drug overdose deaths, those are deaths in general, of 15 to 24-year-olds, was related to ingesting fentanyl. And over the past couple of years, overdose rates among teenagers specifically have tripled. But in a recent study, 73% of teens say they've never even heard of fake prescription drugs being made with fentanyl. So that's kind of some of the background behind this crisis.
Brandon, what you just shared is alarming in terms of that kind of an escalation. Are we effectively addressing it at this point? Are we effectively sounding the alarm so people are aware of this?
Well, it certainly is being disseminated more into the public forum,
Okay.
and certainly being addressed in a lot of different areas. Certainly, for a while, medical first responders and police officers have been aware of this issue. But I think more recently, especially in the last 18 to 24 months, that's when I've really seen more parents and schools and community organizations take interest in this issue and really start pushing it. As to well, it's being addressed. I mean, there are just so many ways to consider that question. I think, from my standpoint, working with teenagers, spreading the information, both the teenagers and their parents, is really the most important thing right now.
So share with me your perspective professionally. Why is there a fentanyl overdose crisis right now? How has this come through?
Well, there's a couple things going on. So, fentanyl is incredibly potent and dangerous at very small amounts. So, doses as low as 2 milligrams, which is a very small amount, is potentially lethal. And so that makes, since these things are being made in kind of underground laboratories or people's basements potentially. The manufacturing errors that could happen. That's a really big issue. So when they're making these drugs, no one's really measuring it scientifically, and so it's really dangerous to experiment with them. And then again, the Mexican cartels, where they're shipping these drugs, the precursor chemicals in from China, India, and they're manufacturing this on a large scale, and they're mixing it with all the drugs that American consumers are really buying in large amounts. So over the past several years, we've seen from that kind of political, especially in San Diego, Southern California, that geographic perspective, we've seen a flood of this substance
Mm.
in our community. And then the other side of it just has to do with our teenagers these days. They really are struggling. There's a mental health crisis among teenagers. And that's part of this as well, because teenagers struggling with overwhelming emotions, the excessive impacts of, or the impacts of excessive social media use, all the lingering effects of the pandemic. Um, they are using substances at times to manage those feelings and those complicated situations and stressful experiences. And most teens who overdose on fentanyl don't even know they're consuming it. They're buying something like Xanax or cocaine or MDMA or even marijuana at times, and they're getting it without knowing it. So, national rates of youth drug use are slowly but surely dropping, but fentanyl overdoses continue to escalate at a really terrifying rate. And one thing I really want to point out is this is a brand new scenario, because 10 years ago, I deal with parents who maybe experimented with drugs when they were in high school or college, and they're a bit forgiving about a lot of it. But this is a whole new world these teenagers growing up in. 10 years ago, this wasn't an issue. When I was growing up, this wasn't an issue. The risks for teenagers who are experimenting with drugs, even without trying to obtain fentanyl or not even focused on that, the risks are just a lot greater for this particular generation.
Yeah, I would just highlight that point. I mean, years ago, maladaptive ways of coping for teens wasn't a lethal, potentially lethal. I think OxyContin changed some of that. And then this
Yeah.
is like a next iteration. And especially as you spoke to just a few granules. I mean, as I understand, it's basically a couple of grains of sand. It has a lethal impact potentially.
Yeah, that's just terrifying. It's just scary, and that's why there are so many accidental overdoses of both public figures and celebrities. I mean, even if you go through the news of the past 6 weeks, and then our teenagers in our communities all across the country.
So, Brandon, how do we empower the community? I mean, first and foremost, starting with parents. What do parents need to know?
Well, I think it's really important for parents to start conversations with their children and teenagers about drug use and fentanyl in particular, before they even think it's necessary, because unfortunately, parents are often the last to know about their child's drug use or experimentation. And since most teenagers who are overdosing, are not aware they're even using fentanyl, it's important to directly address the risks with children. And not to exaggerate the harm here, but last year, a 13-year-old junior high student in Bakersfield, California, was arrested for bringing 150 lace fentanyl pills to his middle school.
Wow.
So these conversations, that's terrifying. As a father myself of three young children, and I feel these conversations need to happen much earlier than parents are usually comfortable with. So that's one thing, is just to talk about this with your child, even if you don't suspect or are worried yet about their drug use, because it may be circulating in their environment.
Yeah.
I think another thing for parents to know is that Narcan, also known as naloxone, is a life-saving medication. It reverses the effects of opioid overdose. It's fairly easy to administer. It's usually a nasal spray. That's the way that parents often just can disperse it. It's also can be an injection. It's carried by every police officer and first responder in the nation right now, and it's being stocked in a lot of elementary and junior high and middle and high schools. And it's prescribed by psychiatrists to parents and any over primary care physician if you have some concerns about your child using drugs. And there's also nonprofits. There's one in San Diego. I have to find the name of it for you, but they'll give it to parents for free with training. And so parents who suspect their children may be using drugs or have learned that their child may have used prescription painkillers or Xanax or harder drugs, even experimentally, should consider keeping some Narcan available at home. Um, and
Great
then
point.
and another thing for parents, I think, to know is that effective treatment options are available for fentanyl use. Obviously, there's a lot of emotions that parents have when they think about this, and it's just important for parents to know that treatment is available, help is available, and the prognosis is good if children get a lot of support early on.
So
The research is
Brandon,
yes, please go ahead.
Is fentanyl addictive? So as someone is exposed to it and tries it, uh, is that going to create a desire or yearning for more fentanyl? How does that drug operate in the system?
Yeah, that's a great point to make. This drug is highly addictive, highly
Yep.
addictive. It's an opioid, and because it's highly addictive, and because there are these withdrawal symptoms when people
Mm,
stop using it, they can be pretty significant, and they can be very intense. You know, expecting a teenager to stop using based kind of on their own willpower or a lecture about like kind of the morality of it, or even using punishments, taking away their cell phone or their car, that's not really a realistic way to go about treating this
yeah.
potential disease of addiction, especially as we know that with teenagers and children, the earlier they get help for their drug use, the more chance there is for them to move on and not actually fall into a lifelong challenge with addiction. Early intervention is really important, and I think
How,
that's. And so, please go ahead.
yeah, how would a parent recognize? What would be like signs, symptoms that they may look out for that their teen or young adolescent might be using something like fentanyl?
Well, some of the more typical ones might be some intense changes in mood or the way their child is behaving or communicating at home, definitely changes in their sleep patterns, how well they're doing in school. Those may or may not be related to substance use, but those would be some first early warning signs.
Mm.
And then obviously, teens, vaping or experimenting with drugs that aren't as hard, like marijuana. It may be important to be thinking about that too, if that's leading to something else later on, or are they using it in a way to really cope with some other issues in their life that may drive them to try harder drugs at
So,
some point.
some of the things you spoke to there, Brandon, are also typical of a teenager in terms of mood changes and irritability and sleeping habits. But what you're speaking to is something that a parent would recognize as a marked difference from what has been typical for their child.
Yeah, yeah, and that's a really good point, which is why this is really difficult sometimes for parents to kind of tease out, and why open communication is so important, and why even if you catch your child experimenting
Mm.
with other drugs or with nicotine, sometimes really having a non-reactive approach and trying really hard to keep that communication open. As a family therapist, that's something that's really primary in my work with parents, is
Mm.
to show them that their relationship with their child is really the biggest protective factor. Parents really feel they need to intervene sometimes pretty severely because they're afraid, and justifiably so. But I feel that these conversations should happen on a regular basis with your teenager. And the more you can respond non-judgmentally and trying your best to listen and put your own feelings aside for the moment. Not saying there shouldn't be consequences or things like that, but at the same time, the most important thing is your child being honest with you and you knowing what's going on in their life.
And some of this, I would think, would be not just the parent, but those in the child's life. So whether it's their teacher at school, whether it's the coach, it's other people that are involved in their life, maybe coming together as a parent, maybe reaching out to those other prominent people in that child's life to get a sense of what they're seeing, what they're understanding. And what I appreciate what you said is there is effective treatment options out there. It's great to see Narcan being more prevalently available in the community and also at schools. You had spoken to a resource that you'd shared before about, I think it's called Harm Reduction Coalition on Point. Share what that is, if you will.
Well, it's a local agency here that gives Narcan and fentanyl test strips at a variety of mobile locations. They can also deliver them to you. So that's, the harm reduction standpoint is really trying to encourage safer and better choices around drug use rather than making, a black and white statement about sobriety. And we know from research that that saves lives. It's really important that we take a harm reduction approach with these things because it is so hard for people to completely abstain. So that's one resource locally that parents can contact to get some um, testing strips and some Narcan if they feel that's needed.
That's great. And so anything that you would leave us, this has been very helpful,
No.
educational. My hope is that this empowers, our families, our parents to get educated, become aware. Any other resource, I would assume Sharp Mesa Vista and the Changes program, there's resources and treatment available there. Anything that you'd like to leave us with just in closing?
Well, I would just like to mention that our hospital, Sharp Mesa Vista, does free community assessments for all our programs. It's a free service that we offer. So if you call 858-836-8434 or look us up on the internet, you can get an assessment for your child. And while we may be advocating for some of our programs, we also give parents all the resources in the community and really try to work with every family to find the best treatment plan for their child given the circumstances.
Brandon, if you will, one more time, Sharp Mesa Vista Hospital and that phone number, 858.
836-8434.
Fantastic. Brandon, thank you so much for the work that you're doing and for helping educate all of us today.
Yeah, thank you so much, Jonathan. I really appreciated the chance to talk about this.
Until the next time we come together, please be well.